I'm Creighton men's basketball coach Greg McDermott. I'll be moderating our discussion tonight about COVID-19 in the Creighton community. In addition to being a coach, I have a daughter in college as well as two sons, one of whom has spent the last 2 months in the NBA bubble at Disney World playing for the Indiana Pacers. So I have concerns about this pandemic as a father and a coach, and I'm looking forward to learning more from our panelists tonight. We made it through the first week of in-person classes, but we need to stay vigilant if we all want to remain on campus until November 25th. I'm sure you've heard or read about some universities reverting to online-only learning because of COVID-19 outbreaks. And I know you don't want to see that happen at Creighton. We must all follow the guidelines of health professionals and scientists regarding facial coverings, physical distancing, hand hygiene, and screening check-ins. Regardless of whether you live on or off campus, we all need to remain vigilant. To that end, joining us tonight are three physicians who will be sharing their guidance, observations, and recommendations. Dr. Horty, if you could introduce yourself first.
Thank you, Coach. I'm Carrie Horty. I'm the Student Health Education and Compliance Medical Director at Creighton, and I just joined at the beginning of the pandemic in February. I have 5 kids, and we are knee-deep in contact tracing, so we've spoken to a lot of you on the phone and seen you in clinic, and I appreciate Coach McDermott, Dr. Tierney, and Dr. Vivekanandan's leadership and guidance with us navigating the COVID pandemic.
I'm Dr. Vivekanandan. I'm one of the infectious disease physicians. I have been involved in the COVID pandemic since it started in about March. Have seen over 300, 400 COVID positive patients and been able to take care of our patients and stayed safe. I'm also a mom of 2 kiddos, a 6-year-old and a 4-year-old kiddos, going back to school. So kind of trying to navigate through that as well. So I'll share my experience. Dr. Tierney?
I'm Maureen Tierney. I'm a infectious disease doctor as well. And I actually hail from New York City and went to Fordham University. That was my first Jesuit experience. And for the past 7 years, I've actually been at the Department of Public Health at DHHS in Lincoln. And so worked on this COVID outbreak intensely with my public health colleagues until joining Creighton, where I'm thrilled to be, starting actually in July. So I'm even newer than Dr. Horty. But have a lot of COVID and ID experience. And I'm also a mom of 2 sons, both of whom are Creighton grads. One just graduated virtually from the Heider College just 2 months ago.
Well, thank you so much for joining us. We appreciate your expertise tonight. We've been getting a lot of questions around COVID-19 and how we can keep ourselves and our communities safe. We'll dig into those questions now. Dr. Horty, you've spent endless hours helping us prepare to bring students, faculty, and staff back to campus. What are the most important things we should be doing to protect ourselves and our community?
3 simple things, and it's washing your hands, wearing a face covering, and social distancing. The most COVID that we're seeing is not during classroom hours, but more evenings, weekends, off-campus gatherings, and that's where we're seeing the most COVID spread. So please wear masks when you're not on campus, when you are on campus, all the time. So it's those 3 simple things.
And Dr. Horty, while we're talking about face coverings, how exactly do they protect us from the virus?
They decrease the spread of respiratory droplets from, coming out of our mouths. We know that if a person has COVID and they are around someone who is wearing a mask, they potentially could, there's like a 70% chance if you have a close contact that the person who's wearing the mask around you can actually receive the respiratory droplets. If you are wearing a face covering and the other person is wearing a face covering and you sneeze or cough and you have COVID, there's like a 1.5% chance of transmitting COVID. So it significantly decreases the transmission. The thing with young, healthy people who may or may not be symptomatic, 40% of infections actually occur in asymptomatic individuals. And 50% of transmission occurs before symptoms even occur. So before you have your muscle aches and pains, your loss of taste and smell, your cough, your fever, by then you've already infected people if you've been hanging out with other students or individuals without a mask on.
Well, statistics are important in a game of basketball. And the statistics of wearing your mask in helps of avoiding the disease and spreading the disease seems like a pretty smart thing to do in my mind. Dr. Tierney, I've seen some people wearing their face coverings and it's not covering their nose. Could you demonstrate the correct way to wear a mask and why that's so important?
Well, as Dr. Hardy said, obviously respiratory droplets come out of your mouth, but they obviously also come out of your nose, unless you don't breathe through your nose, which all of us do. So you obviously have to cover your mouth and your nose. But before you're going to put the mask on, you want to make sure your hands are clean. So I'm going to Purell my hands to sort of do the right thing. But you don't want to really be touching your mask or your face without actually cleaning your hands. So either washing them or putting the mask on. And then you want to put a mask on so it does cover your nose. And see, I got some Creighton blue plaid here. And then you want to make sure that it also goes under the chin. So you want to have a mask that fits, that doesn't gap too much, and that covers your nose. If you're somebody who wears glasses like me, a lot of the masks that have a bridge actually help your glasses sort of sit there and so that they don't actually slip down. The kind of mask is important as well. So you want to have, in terms of the cloth coverings, ideally you'd have 3 layers of very tightly knit cotton. 2-layer masks are good. They're not as good as 3-layer masks. The other thing you want to make sure is that you actually are not using the bandanas or the gaiters, because they've actually shown that the bandanas are actually not effective. And those neck gaiters that some folks wear and then they pull up actually have been shown to kind of make respiratory droplets come out more, aerosolize them a little bit more. So they not only aren't as effective, they may actually make things worse.
And Dr. Tierney, it's been mandated in Omaha that face coverings be worn. What's the latest data about the effectiveness of people wearing face coverings both locally and nationally?
So in terms of the mask mandate went into effect just about 2 weeks ago. Unfortunately, in Omaha and Test, Nebraska, there's been a glitch in some of the data. So I can't tell you exactly whether or not there's been an improvement, but Lincoln, which did a mask mandate about 2 to 3 weeks before we did, actually halved their number of cases. So they had an average case rate of 300 cases a week in the middle of July when they instituted a mask mandate. And within 3 to 4 weeks, they were down to an average of 150 cases over a week in that period of time. In terms of the country as a whole, it reached its peak in sort of early July with almost 80,000 cases a day. And the 4 major states were Arizona, California, Texas, and Florida. And in all those states, they either went to a mask mandate or they had the major cities instituted mask mandates and closed bars. And Arizona, our sister states, has really follows their data very specifically. And they went from over 5,000 cases a day to within 4 weeks, less than 2,000 cases a day. And now they're less than about 200 cases a day. So to me, that's almost more evident than any other study, what we've actually seen in states that have had to go to mask mandate and closing bars, how effective those measures are.
It's obvious that works. Dr. Horty, I see students wearing face coverings when I'm on campus. In fact, our student athletes, my basketball players, wear face coverings during practice and workouts. Everybody seems to be pretty vigilant around this. What's your biggest concern that could move us to online learning?
Really the after hours, not wearing face coverings when people are hanging out after hours. Just a little bit of evidence that wearing face coverings really does decrease the transmission. There's an anecdotal story of a hairdresser, I think at a Great Clips or something, and she was wearing a face covering while she had COVID-like symptoms, fever 104, and she cut like 126 people's hair. and there was a mask mandate at this hair salon. So she had a mask on and all of her clients had masks on. They were all tested, all of her contacts, and you bet they were closer than 6 feet for 15 minutes getting their hair done. Not one of them got COVID. So that's pretty amazing. In the beginning of the COVID pandemic, there are ICUs all around the country that were taking care of COVID patients. And at that time, in the beginning of the pandemic, there was really a shortage of N95s. So people were having to care for these patients with surgical masks. N95s are the best for preventing us from inhaling respiratory droplets that are, so tiny that have COVID on them. But even wearing a surgical mask prevented healthcare workers from getting COVID. There's a strong article in the Lancet in June, which did a meta-analysis of lots of different studies, different types of studies that showed a very, very, very strong relationship between wearing a mask and decrease in transmission of COVID virus. So I would hope that people can wear a face covering. Please maintain social distancing, which is sometimes difficult, but do wear a face covering all the time when around friends, family, and all of that.
Thank you.
I have one more anecdote.
Yep.
Sorry. Angela Maynard and Jenny Bragg are the two nurses in student health right now. Missy Lindauer is going to join us soon, and they're doing a ton of contact tracing. We had one student, and we really appreciate when students are willing to be very forthcoming about their symptoms and their exposures. We're not on the, we're not getting people in trouble. We really appreciate them being very forthcoming. It really helps prevent the spread. But we had one student who in 2 days had 17 contacts, and I believe 8 of them tested positive for COVID. So that just shows you how quickly it can spread on campus. And you'd hate to be the friend that's responsible for spreading that and taking out your basketball team, your soccer team, your entire anatomy class, your if you're doing student teaching, the whole classroom there. So it spreads quickly.
Dr. V, sometimes young adults have a false sense of security that they can't get sick or hurt. And I've read that younger people tend to have milder symptoms of COVID-19. What advice do you have for students to ensure that they take this seriously?
Yeah, great question. Just to give you some statistics, just in Omaha, we have had over 125 young adults who have been hospitalized and over 6 deaths in the young adult population. So definitely there's severe consequence when some of the young adults, when they get COVID-19, especially, if you don't have any health conditions like asthma or diabetes, you're at a lower risk. But if you have some health conditions as a young adult, your risk goes up higher. So then you could definitely be hospitalized, have a bad outcome from that. So I think we all need to take it seriously. Recently there's been a study published in JAMA where they looked at COVID-19 cases, even if it's mild, what happens after they got COVID. And now they're noticing it's having an effect on our heart, where our heart is enlarging, cardiomyopathy, and also having irregular rhythms in our heart. So even people who have had mild infection, they're having consequences of that later. So, we want to be able to protect ourselves now and not develop those complications. I also want to kind of talk about what Dr. Horty said as an example. When the COVID-19 pandemic started, we work in a large healthcare system, and I was really worried about how do we keep all the healthcare workers safe. We were getting information from Italy and New York. A lot of people were getting sick and outbreaks in the healthcare system. But what we did in Omaha in our hospital systems were a mandatory universal masking policy. And with that being in place for 6 months now, we have not had any outbreaks in our hospitals. Handful of people have gotten sick, but a lot of outside exposure. So really wearing a mask helps each other and keeps us safe. So that's an example I wanted to share.
And I would say that obviously on campus, we can we can control and the masks are mandated. But I would venture to guess that it's very important if there are social gatherings on the weekend where they're going to see friends, that if social distancing is not possible, that mask absolutely must be worn. Is that correct?
Yes, absolutely. I think, what I love about Nebraska and Creighton is we're so kind to each other. And I find this another way of us being kind to each other and protecting each other. I would hate to see that, if I was the source and I, passed it on to one of my professors who was older and had some comorbidity, and for them to have a bad outcome. So we really have to watch out for everybody in the Creighton community.
Thank you. Dr. Horty, there seems to be some confusion about what exposure means. Can you explain that for us?
Yes, at Creighton, we're using the definition of being closer than 6 feet for 15 minutes without a mask. So if you're closer than 6 feet for 15 minutes without a mask, that's a significant exposure.
And we may be talking about this later, but since we're on the exposure topic, if someone is exposed, what should the next steps be?
They should report to coronavirus response at creighton.edu. It's important to go into quarantine, and I'll talk about what quarantine and isolation are in just a minute. Now that Creighton, starting on August 27th, will be doing COVID testing on campus. If you're able to get a COVID test, it actually is recommended. That way we know if your contacts had an exposure and if they should isolate versus, if they should quarantine or not. So the important thing is not to come to campus if you're quarantining because of a contact. And
I'm going to go a little off script here for a second, but in terms of these exposures, I'm 18 years old, I'm a freshman. I've moved into a suite with 3 other students that I hadn't previously met till I got to Creighton. And I think potentially I may have had an exposure when I was with someone on a weekend, but I don't really want to put my roommates through the possibility of a 2-week quarantine if in fact I test positive. What would you recommend that I would do in that situation?
Well, a lot of these can be a little bit sticky. So getting in touch with student health so we can kind of talk you through like how significant was your exposure. If you were wearing a mask, then just continue to monitor yourself. If you were not wearing a mask, then we would say, let's put you in quarantine so that you don't potentially spread the virus. And I just can't stress the importance of trying to protect your roommates from a 14-day quarantine because you then develop symptoms and get tested positive for COVID. But if you're already, back in your suite and you are with your roommates, you've been exposed, but they have not, you should get yourself into quarantine, and they are like a 2nd-degree exposure, so they can continue to monitor themselves. But it's a very selfless kind of thing for you to do, to put yourself in quarantine so that your roommates don't need to do the same.
Thank you. Dr. Tierney, can COVID-19 be transmitted by touching a surface or object that has the virus on it?
It can, but that's a much less common way of actually getting the illness. The overwhelming majority of cases are via the respiratory droplet route. But actually, a bunch of scientists looked at this early on in the epidemic. They took a variety of surfaces, put COVID on it, and see how long it lasted for. And it lasted on paper for about a day, plastic for about 2 to 3 days, and then stainless steel for a bit longer than that. And that's one of the recommendations for the hand washing, is the fact that if you go and run an errand and you come back to your suite, wash your hands. If you go play basketball, when you finish, wash your hands. Especially wash your hands, obviously, before you eat, after you handle takeout containers. As you can imagine, living in a house with an infectious disease doctor, I drive my husband and my sons a little bit nuts from time to time. And so we came up with this theory that we would do whatever Dr. Fauci does. And so if somebody has a question, there's actually this great, if you just Google, how does Dr. Fauci deal with everyday risks? It tells you exactly what he does with his mail, with his groceries. And I think Dr. Tony Fauci is the most reliable source. See, and if students also, besides the Creighton source, if they want to look up reliable data, because there's a lot of unreliable data out there. But the Douglas County, for those new to Omaha, Omaha is in Douglas County, Nebraska. So the Douglas County Health Department, the DHHS Health Department, and the CDC really have very good, reliable information.
Good. Well, I don't know if Dr. Fauci washes the basketballs after he shoots baskets, but here at Creighton, Coach McDermott does when people are done shooting baskets. So we're trying to do our part. Dr. Horty, can you tell us about the screening process at Creighton? What should students, faculty, and staff do if they're experiencing symptoms or test positive, and who should get tested?
Okay, so the screening process at Creighton, before people come to campus, they do the online Creighton COVID-19 community standard, and that says that they're committing to wearing a face covering, good hand hygiene, and social distancing. In turn, Creighton has increased its sanitation processes, and then we all acknowledge that COVID is in the community. It's everywhere, and you could get it if you leave your house. And then daily we do the Campus Clear app, and that is a way to answer if you've had an exposure to someone with COVID, if you've gotten a COVID test, if you have any symptoms, or if you're good to go and you have no symptoms. Then you get either a green screen that says good to go, or you get a red screen that says not cleared to enter campus. If you get the not cleared, you email coronavirusresponse@creighton.edu and you go back to your room. You do not come to campus. Thirdly, you take your Campus Clear app. If you are tech savvy and have one, otherwise you can just answer the questions for people who have flip phones and old phones. Otherwise, so you go to a temperature screening station and you get your temperature checked. You show them your Campus Clear app and you're good for the day. So anyone who comes on Creighton's campus at this point is still doing temperature checks. I really hope that we make it to phase 2 and we're able to get rid of the temperature checks. And I think everybody on campus would love that, but we need to see a decrease in incidence of COVID-19 both on our campus and in Douglas County, most specifically on our campus. What should a student, faculty, or staff do if they're experiencing symptoms or test positive? Do not pass go, stay in your room, stay home, don't come to campus. If you're short of breath or having chest pain, you should seek help and either go to an emergency room, call 911. If you're mildly symptomatic, you have a fever or headache or muscle aches and pains, you could take Tylenol. If you don't have kidney or stomach problems, you can take ibuprofen, stay very well hydrated. And you should get in touch with coronavirus response at creighton.edu so our nurses and contact tracers can figure out who you've been in touch with. You can get tested on Creighton's campus Monday through Friday from 9 a.m. to noon in the Kiewit Fitness Center. We'll have a COVID Test Nebraska site set up. So it actually is important to get tested if you're able. If you test positive and you live within 300 miles, you can actually go home to isolate, or if you're quarantining because you had an exposure, you can go home to quarantine as well. Of course, we'll take on a case-by-case basis if your home situation, if you have someone who's immunocompromised at home, or if it's not a good situation at home. We'll certainly provide a place for you to quarantine or isolate on Creighton's campus. Who should get tested? Certainly people who are symptomatic, their contacts, and anyone else who wants to get tested. And actually that's quite helpful because there is so much asymptomatic spread that if you're curious and you want to get tested, we'd appreciate you being tested. It would help us get a feel for how much COVID is on campus.
Good. Dr. V, what's the probability of someone getting the virus if they're interacting with someone who has COVID-19, and should both of those people be wearing a face covering?
Yeah, great question. I want to kind of give an example. So let's say I have COVID-19 infection, Coach Mac, you don't. So if you are wearing a mask and I'm not, the probability of you're still getting the infection from me if you're in close contact is about 70%. Even though you had a mask on and I didn't. If I had a mask on and you didn't have a mask on, but I have the infection, the probability of you getting the infection is about 5%. But if both of us have a mask on, the probability of you getting the infection from me is about 1.5%. So that's why it's so important that both of us wear masks at all time, because so some people know they're symptomatic, so we're going to stay away from campus and stay at home and get better. But what you worry about is pre-symptomatic and asymptomatic. Pre-symptomatic is when you have the infection, but you haven't developed those symptoms yet: fevers, cough, shortness of breath, fatigue. Those symptoms have not developed yet. Asymptomatic is you have the infection, but you have no symptoms at all, and you're spreading the infection. So I think that's why it's really, really important that we have to protect each other and wear a mask at all times.
I've also heard, Dr. V, that a loss of your taste and smell is a symptom of COVID-19. Is that accurate?
Yes, it is. So about lower percentile, but it's definitely present. Loss of smell, loss of taste. There's even certain cases where they have GI symptoms as well, diarrhea. So definitely there's a wide range of symptoms. The major symptoms that we see are cough, fevers, fatigue, loss of smell, taste. But then there are other symptoms that can accompany those as well.
Good, thank you. Dr. V, beyond getting sick, how can the pandemic affect our students' social, emotional, and mental well-being, and what can they do to stay well?
That's a great question. It's been hard on everyone since the pandemic, for socializing, for emotional well-being. I think we have to give our students and all of us creative ways that we could still hang out, physically distance, wear a mask, be outside, social distance, but still be able to do activities and have that human connection. So we need to come up with creative ways to be able to do that. I also think we are going to have some of our students, faculty having some anxiety, some depression can happen because of the pandemic too. And I think it's really important to seek help when we're feeling down as well, using our service at Creighton University for mental health to get that help when we need it. But I also think it's important to be able to socially distance and be able to have a community in small groups, a group of 4, group of 5 students hanging out, but they still wearing a mask and be able to connect with each other.
Mm-hmm. Dr. Tierney, like all of us, our students are craving social interaction. How can they socialize in a manner that's safe?
So I'm going to follow a little bit on what Dr. V just said. I really appreciate the opportunity to also just say one thing about what they call super spreader events, which Dr. Hardy sort of referred to before. But, parties and bars are really the 2 major things that folks have to try and avoid. When you actually have somebody who's pre-symptomatic or asymptomatic, has got a large, what we call a viral load, you put them in close contact with large numbers of people over a long period of time in a poorly ventilated area. And it is amazing how many people they can infect. There have been multiple events where one person has infected up to 150 people. And so it's those sort of situations. And I think we sort of said to this before, if you turned out to be the person that after contact tracing was determined to be that source, how would that make you feel? Our students are very kind, men and women for others and would never want to do that. So by what Dr. V said, so you really want to try, and one of the things I think people talk about is having sort of like a quarantine crew or a pandemic pod, so for you, Coach, it's, your basketball team. So if they're there, and that's probably a little bigger crew but for students to have like their suite mates, they're really sort of good friends, but they hang out with 4 or 6, but no more than 10 people at a time. And as we said before, the 2 masks, adding more 6 feet or more, 10 feet's better than 6, more distance and good ventilation. When you put those things together, you can you can decrease transmission to way lower than even 1%. So, starting to get creative. In my house, we actually play glow-in-the-dark badminton at night. Playing tennis, going to the zoo or Lawrence and Gardens are actually places where you can be outside. They have great physical distancing parameters there that you can follow, and then coming up with other creative ways.
And you were talking about the basketball team, and we've had to adjust in athletics as well. Basketball is a game that's played 5-on-5 with 10 players on the floor, and at least during phase one, we've really limited our workouts to smaller groups, generally with their roommates, so that they're with the same people that they are with in their living arrangements. And our hope is, as time goes on and we can hopefully graduate to phase two, that we can get to where there's some 5-on-5. But across the board in athletics, our teams have made adjustments in not just our individual workouts, but our strength and conditioning, our nutrition, everything that we thought was normal before. This is a new normal. And what I've said to my team is that this is going to be a year of, we're going to have to be able to adapt. We're going to have to be able to adjust, and it's going to be different. And our challenge is we have to do different, better than everybody else. And I really think as a campus, we're in that same situation. So we're certainly trying to do our part in athletics, and I hope our student body will as well. And Dr. V, you talked about physical distancing versus social distancing. Can you explain what you mean by that?
So I don't like the term social distancing. It says that we can't socialize. I really like the term physical distancing, because what we just need to do is have that 6 feet apart from each other, and we could still socialize, just have that physical distancing. So I like that term, thinking in a way we have the physical distance between each other, but we could still continue to socialize. And I think that's a healthier way to think.
Sounds good to me.
Yeah.
Dr. Horty, there's also a lot of confusion between quarantine and isolation. Can you explain the difference?
Certainly. Isolation is preventing the spread of COVID. So if someone tests positive, or that if they have COVID-like symptoms, we put them in isolation, and you have your own room, your own bathroom. If you're on Creighton's campus, food is brought to you. And so that's for people who've tested positive or who have very likely COVID-like symptoms. Quarantine, on the other hand, is you've had an exposure to someone with COVID or COVID-like symptoms, and you're preventing the potential spread of COVID, and that's for 14 days. The reason why that's longer than the 10-day isolation period is because sometimes it takes a longer period of time to develop enough of a viral load to develop symptoms, or to even test positive. Unfortunately, students cannot test out of quarantine. So if you know that your friend has COVID, and you go get yourself a COVID test and it's negative 3 days after your exposure, that doesn't mean that tomorrow or the next day or up to 14 days later, you might not test positive. So we do encourage testing, but you can't test out of quarantine.
Got it. And before we end, I guess I would just like to ask, I sense with some of our athletes that if they were to become symptomatic and then they test positive for COVID, I sense that they feel like they're going to get in trouble if that happens. And we've tried to share the message in athletics that's not the case. Like, things happen, exposures happen when you don't expect it. Try to do your part through social distancing and proper hygiene and wearing a mask, but there's still a chance that it could happen. And I guess, Dr. Horty, how would you react to someone that's afraid to come forward if they're having symptoms or if they think they might have been exposed?
Well, kind of like Dr. Tierney and Dr. Vivekanandan had stated, that you would feel so horribly if you spread it to hundreds of people, and ultimately you realize like you are contributing to the reason why we had to go from in-person to virtual. when you report yourself to coronavirus response at creighton.edu, we're there to help you. We're there to get you to the right place, quarantine, isolation, or home, and help you navigate through symptoms. But, you know, when we have individuals who blatantly put the health and safety of the entire university at risk by throwing a party, then there may be consequences. So, you know, we really want people to come forth and be honest, but we also want people to know that they can report to tell someone. That's the online anonymous reporting. If they feel that there are people who are blatantly putting all of us at risk and making it so that we can't finish the semester here in person.
Well, thank you. And I can't thank you three ladies enough for sharing your expertise with us tonight. We're blessed to have people of your ability and knowledge to share these ideas with us. And I know we all want to make it to November 25th, the end of the semester, and I know I want to have a basketball season, and I think there's a lot of Blue Jay fans that would like to have a basketball season. So I hope we wear our face coverings. I hope we practice physical distancing. We wash our hands. We stay home if we don't feel well. And let's set an example for other universities and stay safe, stay healthy, and stay Creighton.
Thank you, Coach.
Coach.